Welcome to Drug-Free Workplace PA's presentation on Addiction is a Family Disease. In today's education, we're going to look at addiction as a family disease and the impact on families, self-care, recovery, and resources. Addiction is a family disease. For every person with a substance use disorder, there's an entire family behind them. Parents, grandparents, children, spouses, siblings, aunts, uncles, cousins. If you know a family that's stumbling through the chaos of a loved one's substance use disorder, offer support. If you're a family member that's living with a loved one's substance use, know that there's no shame in asking for help. In the United States, 1 in 3 adults report substance use or addiction within their family. 1 in 2 people know somebody that is struggling with an opioid use disorder. 42% of these families admit being less productive or distracted at work and home due to substance use or addiction within their families. Addiction affects the entire family. In the United States, more than 3 million grandparents are raising their grandchildren. Pennsylvania ranks number 7 nationally for grandparents that are raising grandkids due to the opioid crisis. In Pennsylvania, over 89,000 grandparents are primary caregivers to 164,000 grandchildren. And that number only counts children who are formally placed through court systems. It's estimated that for every child placed with a relative through court systems, another 20 are being raised by relatives outside of the system. The impact on families is huge. When substance use is happening within the family units become stressed and tense. Communication really breaks down. It can become negative or non-existent. Family stability and financial stability are greatly impacted. The mental and physical health of family members deteriorates. And in families that have parents with a substance use disorder, there's a complete role reversal. You may see families where the children might act like they're the parent. The impact is huge on families. Family members live with extremes. They're not sure what's going to happen from moment to moment. They don't know if their loved one is going to survive through the day, if when they leave home, if their loved one would be missing or maybe go to jail, living in the fear of the unknown all the time. Oftentimes, family members think they can fix what's going on. If that were that simple, none of us would be sitting here today. Oftentimes, family members live in a system of denial. They think they didn't really see what they thought they saw or hear what they thought they heard, that there must be a good reason that happened. There's a lot of emotional consequences, behavioral consequences, a lack of self-care. Manipulation is huge within the addicted family system. And addiction eventually becomes the only focus within that addicted family system. Family members quickly learn the unspoken rules. Don't talk, don't trust, and don't feel. I can't talk to anybody. Who could I talk to? And what would they think if I told them what was going on? And I don't know who I can even trust with those feelings or to ask for help. And what if I do ask for help and it turns into trouble for my loved one or my family? Oftentimes, family units live with that pain for a long time, and oftentimes we learn to numb our feelings. We no longer feel anything. The typical functioning family system versus the addicted family system. Within the typical functioning family system, we're promoting the health and wellness of each member We're providing for basic physical and emotional needs, learning that attitudes and beliefs and values of the family culture. We're learning social and interpersonal skills and becoming productive, functioning members of society. Within the addicted family system, there's a failure to meet the needs of children, a failure to acknowledge the emotional needs of children. We learn it's okay to not have certain feelings and not okay to have certain feelings. We live in the constant fear, guilt, and shame of what's going on within our lives. It's so easy to forget to take care of ourselves, and self-care is so important if you are living within an addicted family system. You can't pour from an empty cup. You must take care of yourself first. It's easy to become so wrapped up in our loved one's addiction that we just forget about us. And it's really, really hard to grasp and learn to practice self-care while our kids or other family members are doing so poorly. We learn from a young age that the children always come first. We learn that, if there's only food for me or my child, I'm going to go without and feed my child. It's like that old adage on an airline when the flight attendant tells us if we were to crash that we should put our oxygen mask on first and then our child's. And we think, no way, if anybody's going to survive, it's going to be my kid. But the truth is, you can't help anyone else if you're not here to do so. It's really important to remember to take care of yourself so that you're healthy and have a clear mind to be able to help your child that's living with a substance use or your other family member. We do recommend that you take a few moments each day to just focus on yourself, find a hobby or something that you enjoy doing, something that you used to enjoy doing, find a quiet place within your home or outside and read a book or enjoy a craft or a hobby, take a walk, enjoy the weather, do something for yourself, exercise, and every day build onto that. Once you start getting comfortable taking that time away for yourself, add on to that and take longer times away for yourself. It's so important to build that foundation so that we can be healthy and make healthy decisions for our family. Oftentimes, as family members, we're told that we're part of the problem, but family members can actually be a part of the solution by helping through understanding. Drug-Free Workplace PA does offer an entire family workshop and family series for family members. To learn more, please reach out to us. Our workshop series is based off of the Partnership to End Addictions parent peer coaching program. 4 of our staff members are trained as volunteer parent coaches with the Partnership to End Addiction, and we are able to use their programming within our family educations. This program is evidence-based skill building programming built specifically for families that have a loved one struggling with a substance use disorder. It was developed to help parents and caregivers learn new ways to understand the behaviors associated with substance use, the process of change, and to learn new strategies that can help their loved one initiate changes and support that process. Within this workshop, that are offered: acceptance commitment therapy, motivational interviewing, and community reinforcement and family training craft. If anybody is interested in taking this education, please reach out to us. Also, every education that we do offer at Drug-Free Workplace PA is free of charge. Recovery can happen. Oftentimes as families, we're focused on the negative of what's going on. It's really hard to have a clear picture and see recovery, but recovery can happen. Recovery is actually the expectation. What is recovery? Recovery from a substance use disorder is a process of change through which individuals improve their health and well-being, live a self-directed life, and strive to achieve their full potential. It's so important to know that everybody's journey to recovery is their own, and it might not look like your friend's child or your friend's spouse's journey to recovery. Everybody has their own journey, and what works for one person might not work for the next. There are 4 major components that support a life in recovery, and those are health, home, purpose, and community. It's so important for our loved ones to build relationships and have healthy social networks, to engage in meaningful daily activities, have a safe and stable place to live and work, and make informed, healthy choices that support physical and emotional wellness. In the United States, there's 22 million adults that are in recovery. Right here in Pennsylvania, that number is 851,000. Most people in recovery contribute that success to support of family members, employers, sponsors, and support groups. We know that for every dollar that we spend on substance use treatment, society benefits by more than $12. And that's because people are more engaged with their families, they are working, there are lower healthcare costs, and there's a reduction in criminal activity. Drug-Free Workplace PA, DFWPA, has many family resources available, and I'm going to share a few great resources for family members to have. Pennsylvania Department of Drug and Alcohol Programs Get Help Now hotline is a great number to know and have on hand should you need it. 1-800-662-4357. In Pennsylvania, there is help available for anybody that has a substance use disorder and their family members. So go ahead and call this number if you have a loved one, a neighbor, somebody at church, anybody you know that might be struggling with a substance use disorder. And this number can help you to navigate resources in your local area. Pennsylvania Kin Connector is a great resource for relatives that are raising a child. Again, the Pennsylvania Kin Connector at kinconnector.org. And the Partnership to End Addiction is a fantastic resource for family members that are living with their loved one's substance use, and they can be found at drugfree.org. There are a ton of resources available on this website, and the Partnership to End Addiction also does offer a free peer-based parent coaching program that is available to family members. Thank you for joining us today.